Hello, my name is Ning. I'm a research scientist from Penchen Laboratory in China, and I recently published a paper in JMIR named Online Health Seeking Behaviors and the Information Needs Among Patients with Lymphoma in China, Study of Regional and Temporal Trends. In this study, we analyzed threads posted by lymphoma forum users in the past decade. Through analyzing more than 110,000 threads, we mainly want to know who were posting questions online and what kind of questions the forum users were uh, caring about most, and also if their questions were properly addressed. So we had three major findings. The first is that in the past decade, um, the users from coastal regions or wealthier regions, they tend to post questions more frequently than the users from inland regions. And this correlation was very between the uh, gross regional product and the foreign participation rate was very significant. Um, the second finding was that when we used a large language model to classify the questions, and we found that about 34% of the questions were for seeking help in interpreting medical reports, and 20% of the questions were about treatment plan selection, and 30% of the questions were general medical related questions. Um, we had a hematologist to look into a set of randomly selected threads, and we found that 96% of the questions received responses online, but only 37 of these questions received useful insights from the other forum users. So, in this study, we observed that there's a regional inequity in online health seeking behavior, and also the user raised questions were not always properly addressed. So we suggest that in this AI era, there can be a medical chatbot which can help users to learn more medical information online. And also, we suggest that government and clinical experts help to advocate this chatbot so that people, especially those who are from inland regions, they are more aware of the help they can obtain online, and they can get more um, reliable and timely online medical information. We chose JMIR because our study aligns well with the journal's scope, and we were happy that the review and the revision process was very smooth.